Melanonychia is a medical word that means a dark color, usually brown or black, appearing on a fingernail or toenail. It looks like a stripe, a spot, or a whole nail that is darker than normal. It can be harmless or a warning sign of a more serious problem, so doctors pay close attention to it. The dark color happens when a pigment called melanin builds up in the nail plate. This can be caused by many things. A small injury to the nail that triggers extra pigment. Certain medicines, such as chemotherapy or antimalarials. Infections like fungal or bacterial nail disease. Natural skin color. People with darker skin often have faint bands. A benign mole, nevus, under the nail. A rare skin cancer of the nail called melanoma. Think of it like a chalk drawing that appears on a table after someone has brushed chalk over it. The source can be a spill, a pen, or a deliberate drawing. A person with Melanonychia will see a brown-black line that runs from the cuticle toward the tip of the nail. The line may be thin like a pencil line, or wide like a thick marker. Sometimes many nails are involved, and sometimes only one. The nail may feel normal, but if the band is suddenly getting wider, taller, or changes color, it can be a sign of trouble. Occasionally there is pain, swelling, or a split nail. Doctors first look at the nail with the naked eye, and then use a handheld microscope called a dermatoscope. The tool shows patterns that help decide if the band is likely harmless or needs a biopsy. If the doctor suspects melanoma, a small piece of the nail matrix is removed and examined under a microscope. Treatment depends on the cause: stopping an offending drug, treating a fungal infection, removing a benign mole, or surgically excising a melanoma. Most harmless bands are simply watched every few months. You can lower the chance of a new dark band by protecting your nails from repeated bumps. Wear gloves when doing heavy work, keep nails trimmed short, and avoid tight shoes that press on toenails. If you take medicines known to cause pigment, ask your doctor if a different drug is possible. Regular self-checks, like looking at each nail in a mirror once a month, help catch changes early. In the last few years, doctors have improved the way they spot dangerous melanonychia. High-resolution dermoscopy, reflectance confocal microscopy, and even artificial intelligence apps can compare the nail picture to thousands of known cases. Researchers are also studying genetic markers that may predict melanoma risk in the nail. These tools make it easier to decide when a biopsy is truly needed, reducing unnecessary